Hello everyone, this is Dr. Vasil. I'm a consultant orthopedic surgeon. I work at Cantonment Hospital, Bolaram, Secunderabad, and also I'm a consultant orthopedic surgeon at Renova Hospitals, Kompally. Right. So today I would like to talk about a few topics which address a few pain points, problematic statements in our elderly population. Okay. So the first and most commonly asked question, to me in my OPD practice is about bone health, general bone health. You know, how to maintain bone health, etc., etc. So I would like to address that topic first. Like the first topic is general bone health. So usually, what happens is, bone health is not separable from the topic of osteoporosis. So osteoporosis is basically, weakness in bones that, comes up with aging basically. So men or women are peak bone density or our bones are the strongest when we are 30 to 35 years old. After the age of 35, the bone mineral density in both men and women reduces. After the age of 30-35, the bone mineral density reduces. And in women, especially after menopause, let's say around 50 years or 48, 52, especially after menopause, there is rapid decline in bone mineral density, especially after menopause, due to less production of the hormone estrogen. In men also, the bone mineral density declines after 50 years of age, but in women, it is drastic after menopause. So both men and women after the age of 50 55, the bone mineral density is significantly less. So this causes them to have clinical symptoms such as generalized body pains, weakness, joint pains, and still worse, fractures after trivial falls. Okay. So this is what usually happens as age progresses and after menopause in women. So to prevent this, we need to have an adequate balanced diet right from young age through our elderly age. And also once we reach, let's say 40, 50 years of age, after that, we regularly take calcium and vitamin D supplements to boost our bone health and take certain diets that are, good source of calcium. But I personally would suggest calcium and vitamin D supplements after certain age. All right. So my next topic of concern that I would like to address. So these topics are based on whatever I have personally observed in my patients in my regular day practice OPD, and also the frequent questions asked to me on a day-to-day basis by my patients. So I'm addressing, this video is nothing but a compilation of all what I, on a day-to-day basis teach my patients. What questions that are asked, the questions that are shot at me. So the next topic that I would like to address is posture. Very commonly in our OPD practice, orthopedicians, we come across young patients, elderly patients, like, irrespective of age group, men, women, we come across patients who commonly complain three things. First thing is neck pain. Second thing is low backache. And third thing is knee pains. So these complaints, neck pain, low backache, and knee pains, these three problems are commonly encountered by us in our day-to-day practice, irrespective of the age and gender. So we see these symptoms, we see these issues in both young age group and elderly age group. So let's start off with neck pain. Neck pain is, fairly common, especially in younger individuals because of excess of phone usage, excess of laptop systems, computer usage, especially in our software professionals. Okay. So two things I would like to suggest from my side to avoid neck pain are: one is to avoid excessive bending of neck, this is called as flexion. So excess of bending of neck has to be avoided. This could be during reading or writing, or let's say specifically using phones. So whenever we are required to use our phones, so let's keep our phones at the level of our eye. Let's say at this level, and then that's how we use the phone. We don't use our phones like this. We use our phones like this and try to minimize the screen time. Okay. Second, avoid using thick pillows or avoid using hard pillows. Try to use soft pillows while sleeping. Okay, or pillows that are not that thick. So these two things I would suggest. These two precautions I would suggest for neck pain. Coming to our second most commonly encountered problem. In fact, number one most commonly encountered problem is low backache. Again, this is common in young patients and more common in elderly patients because of degenerative changes. So following are the precautions to prevent low backache in all age groups. First one is sitting on the floor. Sitting on the floor has to be avoided. That is not good for our backs. Sitting at a place, sitting on a chair or sitting on a bed for a long duration of time, that has to be avoided. Let's say our job involves sitting on a chair and writing, reading, or using the system. What I would personally recommend is after every half an hour, we take 5 to 10 minutes of break, move around, walk around, right? Come back, resume our work. So, avoid being stationary, avoid sitting at a particular place for more than half an hour to 40 minutes. Okay. So that is the second precaution to be followed. And third precaution is avoid bending forwards and lifting weights. Could be a child or could be a bucket of water, could be a bag. Just avoid bending your back forwards and lifting weights. Or even avoid bending forwards and picking up objects. Let's say a piece of paper has fallen, a pen has fallen. What people do is they bend their backs and lift weights. Or pick up objects. Instead of that, you just squat and pick up objects. So these are the 3 precautions that I would suggest to prevent low backaches in all age groups. And coming to the third in fact, one of the most commonly encountered orthopedic problems is knee pain. It is more so commonly seen in elderly people, but also seen fairly enough in middle-aged people. So again, I would like to suggest 3 precautions to prevent, knee pains or avoid arthritis altogether. Okay. First one would be avoid using steps. Do not use steps. You can climb down steps, but do not climb up steps. You try to use lift as much as possible. If you want physical activity, you can swim, you can cycle. In fact, you can even walk around. These are good physical activities. But steps are not good for your knees, especially upstairs. Second thing, again, sitting on the floor. Sitting on the floor, excess of flexion or folding of the knee is pretty bad for your knees. It causes early wear and tear of your knee joints. Okay. So avoid sitting on the floor completely. Third thing is fairly understandable is to use, Western toilet or Western commodes instead of our classical old school Indian toilets whereby squatting is involved. Because squatting, especially in elderly, is painful and causes, enhanced wear and tear of the knee. So always prefer Western toilets over our classic old school Indian toilets. So these are the commonly encountered problems, and these are the basic lifestyle modifications. They're not that difficult. Basic lifestyle modifications that have to be followed on a day-to-day basis to avoid these common problems. All right. So my next topic of discussion would be frequent falls in an elderly population, or more disposition to fall down, have a trivial fall in our senior citizens. So this is a problem that is not really acknowledged. Not most people are not aware of, and most people have not much knowledge about. So what happens is, in human beings, because we are bipedal, we're not like animals. We don't walk on 4 feet. We walk on 2 feet. As it is, we are working constantly against gravity. Okay, so pretty much, we are constantly working against gravity because it's just 2 legs supporting an entire body. So young age, it is fine. After a certain age, again, both men and women, especially in obese people, especially in diabetics. What happens is they're more prone to fall, have trivial falls, fall for silly reasons at home, the foot gets stuck in the mat or rug and they fall. This is common in obese individuals. Also, it is common in diabetics because in diabetes, we come across a condition called as peripheral neuropathy, wherein our nerves, our sensory nerves, especially in our feet, are numb. They do not perceive pain or any kind of sensation as much as a normal person is supposed to. So because of that, it is very easy for them to not perceive, uneven surfaces and fall down. So these trivial falls are pretty common in diabetics and obese individuals. And especially combined with osteoporosis, this combination turns out to be disastrous, turns out to be lethal, because it very commonly causes two kinds of fractures. Something we call as distal radius fracture, fracture around the wrist, and still worse, a hip fracture. IT fracture is what we call as, in our technical terms, a hip fracture, which is absolutely disastrous, especially in elderly people, because that would definitely require surgery. That takes the trajectory in a different route altogether. So, a small trivial fall turns out to something disastrous like a hip fracture, whereby surgery becomes mandatory. And then without surgery, there is no way that they could walk normally again. So a small issue can lead into these kind of big things. So our next point of concern is how to prevent these kind of trivial falls. Basic few changes at our home, few things to be followed can prevent these falls. Number one, better avoid rugs or carpets altogether in places, in homes where we have elderly. It is very common for elderly people to have their foot stuck in the rug and have a trip and fall. Okay. And better, especially in washrooms, bathrooms, very commonly we come across elderly people falling in bathrooms, hitting their head. That is another problem where they have head injuries. They have serious head injuries. So avoid slippery surfaces at home. Better avoid, smooth finishing tiles at homes. Always better to have a bit of friction and slippery surfaces. And bathrooms also should have flooring which is little tough. These are very small points, very minor points, which might seem very silly, but in our day-to-day practice, in our emergency practice, in our OPD practice, we very often come across people who suffer, pretty bad injuries because of, these silly things. And also, elderly people after a certain age, especially after surgeries, or let's say, or arthritis in the knees, or diabetics, it's always advisable to have a supportive device. Stand if it is necessary, if their condition requires so, or at least a walking stick, a tripod or a quadrupod walking stick is always helpful while walking outside or inside the house. That acts as an assistive device and prevents these kind of trivial falls. So these and also especially in individuals, elderly individuals who are under care at home after their lower limb surgeries or back surgeries or hip surgeries, is always advisable if there are two caregivers instead of one. So for better day-to-day, better carrying out of day-to-day activities, and to avoid another fall after surgery, it's always advisable to have two caregivers. All right. So my next topic of discussion would be arthritis. Arthritis in general, especially again in elderly population or even in, let's say, middle-aged population, arthritis has fairly become common these days because of our improper lifestyles. So arthritis is basically, wear and tear, degeneration of the joints. Could be your knee joint, could be your spine. What we call as spondylosis. Spondylosis of the spine is nothing but arthritis. Basically, again, wear and tear. It's like a body is a machine. It's like a car, like an engine. Like a car has wear and tear. Even our joints have wear and tear. It is mandatory that as our age progresses, as we get old and old, our joints are bound to undergo wear and tear. It is mandatory. This arthritis, it is not a disease. It is just an age-related. It's basically aging. The way we have gray hair. Everybody has gray hair after a point of time. So similarly, everybody has arthritis of joints, specifically knees and lower back. It does not fall under the category of a disease. So it is basically wear and tear. But there are certain precautions, like I mentioned previously, that can be followed, to prevent this early wear and tear. Instead of, having wear and tear at the age of 40, we can push it to, let's say 70, 75, 80. We can just push it following certain precautions that I have previously mentioned. So most common arthritis seen, especially in Indian population, is arthritis of the knee joints. So again, like I mentioned previously, avoid sitting on the floor, avoid using staircase, and avoid squatting on Indian style toilets. Always prefer Western commodes. By following these three, basic lifestyle modifications, we can delay our knee joint arthritis. We can delay or sometimes altogether avoid our knee joint arthritis. Another very common wear and tear location in the body is the lumbar spine. Lumbar spine is our lower back. Hence, very commonly we see our senior citizens complaining of low back pain. Very commonly, disc problem, low back pain. It's called as lumbar spondylosis. Lumbar spondylosis is nothing but, again, wear and tear or arthritis of the lower back. Like I previously mentioned, few precautions to be followed are: avoid sitting on the floor, avoid bending forwards, and avoid lifting weights. Also, prevent sitting in a particular place for a long duration. So these are the 4 to 5 precautions that we follow to, delay or sometimes altogether avoid lumbar spondylosis or chronic low back pains. So these are the very commonly encountered arthritic changes in our population. One minor variant I would like to end my topic of discussion by mentioning is rheumatoid arthritis. Most people do not know what is rheumatoid arthritis. So rheumatoid arthritis is a disease. It is not an age-related process. It is not that all of us are supposed to get eventually like gray hair. It is not like that. Rheumatoid arthritis is nothing but inflammatory arthritis or, inflammation of the joints. It usually, is seen in women, especially in their 20s, 30s, sometimes 40s.